We have to also look at the platypeloid pelvis. It corresponds to a simple flat pelvis that is characterized by a kidney-shaped brim or a bean-shaped brim. And when you are to draw a bean, you will realize that it has a short anteroposterior diameter. So the brim is having a short anteroposterior diameter, and so the fetus is not going to be able to negotiate through that short diameter, and so it may not allow delivery. But let's look at other features and see whether it will really not allow delivery. Now, when you look at the pelvic cavity, it has a wide transverse diameter, it has a flat sacrum and shallow cavity. When you look at the ischospine, at the pelvic outlet, the ischospines are going to be blunt. The subpubic angle is going to be greater than 90. So, what is the effect of labor on this type of pelvis, platypeloid pelvis, which is flat? The fetus or the fetal head is going to engage with the sagittal suture in the transverse diameter. The sagittal suture of the head is going to be in a transverse diameter. So the sagittal suture of the fetal head, this is the sagittal suture of the fetal head, is going to be in a transverse diameter if a woman is having a platypeloid pelvis, but usually descends through the cavity without difficulty. Engagement must necessitate lateral tilting of that head, known as asynclitism, in order to allow a biparietal diameter to pass the narrowest anteroposterior diameter of the pelvis, and the result is going to be a face presentation because there is going to be asynclitism. So, but if the result, if it is high above, if the asynclitism is extensive, the woman is going to require a cesarean section. But if it is not so severe, then a woman will deliver a baby with the face presentation because there is going to be, since it negotiates with the sagittal suture into the anteroposterior diameter. You can demonstrate this. This pelvis negotiates the sagittal suture into the anteroposterior diameter of the pelvis. So it is going to pass with some bit of difficulty, and as it is trying to negotiate, there is going to be asynclitism, whereby there is going to be, the baby is going to deliver by a face presentation, and if possible, this baby can be delivered with a face presentation. If the asynclitism is too severe, then this fetus has to be born, delivered by cesarean what? Section. That is a platypeloid pelvis. The last pelvis that was classified by these guys, Caldwel and Melloy, is the anthropoid pelvis. With the anthropoid pelvis, when a women with this type of pelvis tend to be tall and narrow, and they are having narrow shoulders. So this pelvis that is anthropoid is characterized by an oval brim. And if the brim is oval, the anteroposterior diameter is going to be longer than the transverse one. And the cavity is going to be long and deep, with the deep sacrum. Side walls are going to diverge. The outlet is going to have less prominent ischospines, and the subpubic angle is going to be greater than 90. But what is the effect of labor if a woman is having a type of pelvis known as anthropoid? Labor usually does not present with any difficulties, but a direct occipital posterior position is often a feature. Adapted for engagement may persist up to the delivery. So the fetus passes through the pelvic, remaining in the same position, as so delivers a face to pubis instead of a face to perineum. So the outcome of the anthropoid pelvis is a face to pubis delivery. Dear learners, we have talked about the major types of pelvis according to Caldwell and Melloy. That is the gynecoid pelvis, which favors a normal vertex delivery, spontaneous vertex delivery. Then we have looked at the android pelvis, and we have said the effect of labor is going to be either occipital posterior position and their outcomes, or it can be emergency cesarean section. We have talked about the platypeloid pelvis, and we said the end results, that is the effect of delivery, is going to be a face presentation because of asynclitism. And we have lastly talked about the anthropoid pelvis, where we have said the result is going to be a face to pubis delivery rather than a face to perineum delivery. Why those types of deliveries? Because of the features that these pelvis are having at the pelvic brim, at the pelvic cavity and pelvic outlet. Now, those are types of pelvis that were classified according to Caldwell and Melloy. Meanwhile, we need to know, dear learners, that there are other pelvic variations. There are many other pelvic variations. For example, we have the pelvic variations that were due to congenital abnormality. We have pelvic variations that were as a result of, I said developmental abnormality. We have all others that are as a result of injury or disease. Then we have other types of pelvis that are due to dietary deficiencies. Yes, the types of pelvis that are due to congenital or developmental anomaly. We have the Robert's pelvis, we have the Miguel's pelvis, assimilation pelvis, and then we have the justo minor. Those are the 4 types of pelvis that are due to developmental anomaly. What do they mean? In other words, Robert's pelvis is a pelvis where the alley of sacrum are either absent or they are poorly developed. Therefore, it's contracted in the diameter, and cesarean section is always necessary for this delivery. The sacral alley is either absent or poorly developed. If the sacral alley is absent, that means the ilium of the pelvis is going to attach close or to articulate to the sacropromontory, and you'll find a person has this. That means the arrow of sacrum is directly articulating with the sacropromontory, and on so doing this, it's going to reduce the oblique diameter of the pelvic brim or even pelvic cavity and outlet. So we have the Nigel's pelvis, where the sacrum has one wing, probably due to maldevelopment or congenital abnormality, or it can be due to disease of the sacroiliac joint. A true Nigel's pelvis may occur in a woman who has walked with a limp for many years, and delivery should be by cesarean section. The effect of labor is cesarean section. Now, learners, we also have a pelvis known as assimilation pelvis. When I was taking you through the sacrum, we shared and said that the sacrum is made up of 5 fused bones. But with this assimilation pelvis, we shall find that there is a sacrum that is having 6 bones or 6 vertebrae, and that one is known as a high assimilation. But as yet, we have a low assimilation whereby the bones of the pelvis are 4 in number. They are fused together but 4, and so that is called a low assimilation pelvis. Now we have another one that is also due to congenital or developmental anomaly, that is known as justo minor pelvis. This is a gynecoid type of pelvis where the measurements are reduced or diminished, but it is in correct what? Proportions. It is common in petite women of a small stature. Women that have small hands, small fingers, small toes, small feet, they are having a just minor pelvis. Now, what is the effect of a just minor pelvis to labor? The type of labor or delivery depends on the size of the baby and the husband. If the baby is small, the baby can be able to pass through a just minor pelvis that the mother is having. But if a woman is having a just minor pelvis and the pelvis is small, if the pelvis is small and the baby is big, it will not be able to pass through, so it will require a cesarean delivery. A small baby can be delivered vaginally with little or no problems. I think that I've said. So that is a just minor pelvis. We also have to look at pelvis due to dietary deficiency, and one of them is erratic pelvis. This is a deformity due to rickets, which affected the person in early childhood, and probably it was due to lack of vitamin D and lack of calcium, as that girl was growing in childhood and she ended up getting erratic pelvis. Osteomasic pelvis is also due to dietary deficiency, and probably it is an extreme deformity of the pelvis due to osteomalacia, which occurs due to a deficient diet, or lack of vitamin D, and you shall find that the pelvic brim is Y-shaped in an osteomalacic pelvis. We have pelvis due to injury or disease, and the pelvis we have is asymmetrical pelvis. This is due to the congenital dislocation of the hip, which may follow poliomyelitis or one side of the pelvis being distorted by polio disease. And a woman is going to have asymmetrical pelvis. Dear learners, all these types of the other pelvic variations that we had are contracted pelvis. They are having diminished diameters. Therefore, if a woman is having any of them, it may not be able to deliver a baby vaginally, but can deliver a baby by cesarean section. Thank you for listening to our session. Thank you for understanding the types of pelvis and the planes of the pelvis. Remember to subscribe to these lessons such that you get more lessons. Next time we shall look at the pelvic assessment. We shall look at pelvic assessment in our next lesson. Thank you for being attentive. God bless you. Now.